What if I tell you your skin could actually repair and heal itself like it did years ago? Would you believe me? Today, we're going to talk about PDRN. It's an advanced regenerative medicine, highly used in skin regenerative procedures these days. What is it and whom it is for? And what kind of results you can expect? Let's break it down. I'm Dr. Pranchil. I help my patients achieve resilient skin with a science-backed treatment plan and personalized care. PDRN injections have been creating a buzz in the aesthetic industry. But before you jump in, let's understand what they are and how they work. PDRN stands for Polydeoxyribonucleotides. These are derived from salmon DNA. Okay, don't let that scare you. It's purified, safe, and biocompatible. It works at a cellular level. Basically, it sends repair signal to your skin cells where it will help collagen boost, elastin, and new healthy tissue boost. So PDRN basically works in two ways: skin cell regeneration and anti-inflammatory. When we talk about skin cell regeneration, they're actually working on fibroblasts, which are the cells responsible for collagen remodeling. And when we talk about anti-inflammatory, they're working on the damaged skin cells. So it's ideal for sensitive skin. So with PDRN, we actually combine microneedling. So with microneedling, it helps us absorb it better and target multiple layers of the skin. PDRN injections are great for anyone looking to improve skin texture, elasticity, reduces fine lines and early signs of aging, supports healing after acne and scarring. It calms redness and inflammation. It also works wonderfully for pigmentation. It's suitable for most skin types because it's regenerative, and it's also great for people who can't tolerate aggressive treatments. What my patients actually love about PDRN is it has amazingly natural looking results. Benefits are softer fine lines, even skin tone, smoother texture, and helps you improve skin barrier. Results are noticeable anywhere between 3 to 4 weeks and improves over time as your skin starts to regenerate. For most patients, I recommend a series of 4 to 6 sessions, 3 to 4 weeks apart, and then as per the need, we can do it anywhere around 8 to 10 months apart as a maintenance session. So is PDRN worth it? Okay, if you're looking for something that's safe and clinically backed to improve your skin's health and resilience, then I would say PDRN is the best treatment as regenerative and personally favorite. Also, make sure that you consult a professional to see if it is the right treatment for you.